All right, so we're going to now discuss what else goes into a pre-exercise evaluation before someone undergoes an exercise test. So in the past, we've already talked about how to assess blood pressure, resting heart rate. We talked about the importance of an informed consent and doing a medical screening to make sure that the individual is able and to exercise without any significant risk. So this is just going to elaborate on that a little bit further. So purposes of exercise testing, for the most part, we're doing a fitness assessment. So uh, key goal for most people or purpose of the test is just to determine what the fitness status is of that individual and relate it to the norms that are out there to see kind of where they stand. We also use the exercise assessments to develop an exercise prescription for someone. So we can take this data from the assessments and use it to better prescribe an exercise program that's individualized for this specific person. Also, it's useful. The exercise testing data is useful for establishing reasonable goals and also to evaluate progress in an exercise program. So maybe have fitness assessment done every few months, and that tends to allow people to see how they're progressing. And also, it serves as a motivating factor to continue the program that they're involved in. Then lastly, and this is more specific to testing cardiorespiratory fitness, but you can use a graded exercise test that assesses cardiorespiratory fitness to diagnose disease and also check for ischemia. To do that, generally you need to collect an electrocardiogram, which we are not going to do a lot of in this class, but it is definitely an option for individuals that could be at significant risk. So, general guidelines for a fitness assessment. So, things to consider prior to doing a fitness assessment. So, you want to make sure all the documents that you need are available. Things like informed consent, a health questionnaire, all of that needs to be ready to go, ready for the participant to get there. Make sure the rooms that are at adequate temperature, not too hot, not too cold. All the equipment that you're going to use needs to be calibrated. If you're doing an aerobic or a cardiorespiratory assessment, you would want the metabolic cart to be calibrated. If you're doing strength testing, maybe on a piece of equipment that requires calibration, you want to make sure that's calibrated. Just make sure everything's ready to go. Another thing to consider is the individual's stress level and anxiety. So anything you can do to reduce that is going to generally help the test. A lot of people come in, especially if it's the first time, and they're nervous, as you could imagine, especially if they're going to engage in some type of assessment like a VO2 max test. So you want to provide a calming environment for that person and just to make sure they're relaxed and you'll get the best effort as possible. Uh, Comfortable place to sit down or examination table if you're going to do any supine measurements. And then the tester should be familiar with the emergency response plan. If there's an AED in the room, anything like that, like what to do, what to do if something does go wrong in this whole process. So as far as pre-test instructions, we'll go over that on the next slide. But kind of the general order of things. You want to make sure the participant before they get there has an idea what they're doing and the instructions you might want to give them. Then obviously we're going to take them through an informed consent. Generally, that's the first thing that'll be done. Then medical history, as we used in class, the health screening questionnaire, and then also check for relevant contraindications. So there are a list of contraindications by American College of Sports Medicine that if an individual has any of these, they should not, or it's recommended that they should not undergo any exercise testing. And I'll show you that in the upcoming slides. And then the order of assessments is also something to consider. So generally pre-test instructions you want to give before a person shows up for a fitness assessment include things like not eating, no tobacco, alcohol, caffeine at least 3 hours before. Obviously, with alcohol, that's a good rule might be 24 hours, but 3 hours is the general guideline. You hydrated, so not overly hydrated, definitely not dehydrated, because that could definitely impact the results. Well rested. So generally, you want to make sure somebody's well rested so they can give their best effort on these assessments, especially those that require a max effort. Clothing is important. If you're doing body composition, obviously you wouldn't want someone to wear loose clothes, t-shirt, shorts, that type of thing. They're going to be doing a test on a bike or a treadmill. Make sure they're in the appropriate attire to exercise. Strength testing, same thing applies. Make sure they're in comfortable clothes. Generally, no work-related clothes like jeans or anything like that would be appropriate. So basically, exercise-related clothing. A couple other things to consider. Some of the assessments might be fatiguing, especially if you're doing a VO2 max test. So, making sure the person has a good way to get home or get out of there. Uh, it has happened in the past where people are so exhausted from doing a fitness assessment like a VO2 max that it's probably not a good idea that they drive home. So, just something to think about, that you want to let the person know that it might be an exhausting event. And then any medications, it's good to know any medications that the participant might be taking, especially those that could impact the results of the test. So things like beta blockers, which can impact the heart rate, or any other medication that might play a role in uh, kind of manipulating the results that you're getting from the test. So all of that is good to keep track of. And here's the contraindications I was referring to. So a lot of these are going to sound like a lot of medical jargon, but just a couple of things I wanted to point out. So there's absolute and relative contraindications to exercise testing. These are primarily for graded exercise testing where you're assessing VO2 max. But it's a good rule of thumb to kind of know these and be familiar with these. So you might not know this information unless the individual discloses it to you. But a couple of things I wanted to point out. You can see that the absolute contraindications, they are, if a person has any of these, they should not undergo the exercise test or fitness assessment. So, especially if you're talking about a graded exercise test on a treadmill or a bike. But you can see if you look at the absolute contraindications, it's a lot of acute conditions. So things that are going on immediately, like acute myocardial infarction within the last 2 days, unstable angina, so chest pain that's not predictable, uncontrolled cardiac arrhythmias, and then you see like acute pulmonary embolism, acute myocarditis, acute aortic dissection. All of these are pretty severe conditions that a person might have. So a lot of this sounds like common sense, but this is documented somewhere in the ACSM book, that and basically it's just kind of telling you that, all right, if any person has these, they should not undergo it. It's not safe for them to undergo a fitness assessment. Relative contraindications refer to conditions that a person might have that they're not quite as severe, and they may be able to do the test, but you have to weigh out the risk versus the benefits. So if a person has any of these relative contraindications, but their medical provider, physician still recommends that they go through with it, then that's generally going to be okay. But relative just means that you want to kind of weigh out the risk versus the benefits before proceeding. And you can see these contraindications under the relative portion are not quite as severe. A couple of things that you might come across. So electrolyte imbalance, potentially anemia, you might potentially come across. And then regarding blood pressure, 200 over 110. I know that sounds really high, but someone with severe hypertension, that's also a relative contraindication. So to all these, that could be potentially one that you come across. It's more likely that you will come across. And as far as the order of assessments, some of this is common sense too, but the resting measurement should be generally obtained first. So before they do any physical activity, heart rate, blood pressure, height, weight, body composition, those type of things should be done first. And then as far as everything else goes, there hasn't been an optimal testing order established. So whether you do cardiorespiratory fitness testing first, or muscular fitness testing, or flexibility testing first, there's no official guideline on it. So you generally want to do what makes sense. So a lot of times people will do the cardiorespiratory fitness and muscular fitness testing on different days. But you can do them all in the same day. It's just you kind of have to be smart about planning it out. So if you think the cardiorespiratory fitness is going to be the most exhausting, or you're more interested in that, you may want to do that first. Muscular fitness flexibility. If that's not high on the list, you could put that off till second. If muscular fitness is your top priority, maybe do that first and then follow the other. So it's really up to the tester and the individual to know what's most important for them and to kind of focus on that. And then obviously, regardless of the order, sufficient time should be allowed for measures to come back to baseline levels before doing the next assessment. So things like heart rate, make sure it comes back down. It doesn't have to come back down to complete resting levels, but it should be close to resting levels. Same with blood pressure; it should come down and be relatively stable before you begin the next assessment. And so, just to finish up here, the things that you would want to accomplish in a comprehensive fitness assessment include the resting measures that we've already learned how to do, like resting heart rate, resting blood pressure, body composition, which we'll focus on. That could include just something as simple as calculating the BMI or circumference measures, but ideally it would include some measure of an estimation of percent body fat. Cardiorespiratory fitness, assessing VO2 max, whether it's a maximal test or a submaximal test to estimate VO2 max. Muscular fitness, generally you would want tests for muscular strength and more other tests for muscular endurance. And then as far as flexibility goes, just flexibility of the major joints of the body. Flexibility can be as comprehensive as you would like. You could assess the flexibility at multiple joints, but a lot of times the flexibility assessment comes down to major joints like the hip joint. Sit and reach test is one of the most common tests that's done. Shoulder movement tests are also commonly done for the upper body. And then there could be other tests involved. If you want to assess postural sway or anything like that, you can do that type of analysis, or just a basic balance test to assess the person's balance.